Hello, today I will be talking about the syndrome Cri du Chat. It is a French term and translates to cry of the cat. Cri du Chat, also known as 5p- syndrome, is a chromosomal deletion disorder resulting in a wide spectrum of intellectual and developmental abilities, including a cat-like cry, for which it is most known for. Cri du Chat is characterized at birth by a high-pitched cry, low birth weight, poor muscle tone, microcephaly, and potential medical complications. A small number of children are born with serious organ defects and other life-threatening conditions, although most individuals with 5p- can anticipate a normal life expectancy. Both children and adults with this syndrome are usually friendly and happy and enjoy social interaction. The diagnosis of Cri du Chat syndrome is generally made in the hospital at birth. A healthcare provider may note the clinical symptoms associated with the condition. Additionally, analysis of the individual's chromosomes may be performed. The missing portion or deletion of the short arm of chromosome 5 may be seen on a chromosome analysis. Cri du Chat is rare. It is caused by a missing piece of chromosome 5. Most cases are believed to occur during the development of the egg or sperm. A small number of cases occur when a parent passes a different, rearranged form of the chromosome to the child. Each year in the United States, approximately 50 to 60 children are born with 5p- syndrome. Cri du Chat is a spectrum disorder. This means that there are varying levels of related problems. For example, in swallowing, one individual with Cri du Chat may have normal function. On the other hand, another individual with Cri du Chat may need a feeding tube because of malformations in the larynx. For cognitive, one individual with Cri du Chat may have normal function. This is according to research. On the other hand, many individuals with Cri du Chat have profound limitations in their cognitive abilities. For language, there's often difficulties in expressing language. Some individuals have no speech, while others have many speech abilities. In the parent support information that I found, it encouraged many parents to look into sign language or things like augmentative alternative communication. And for hearing, some individuals may have normal, typical hearing. Most individuals with Cri du Chat have ear infections throughout their life, and it was reported that as individuals with Cri du Chat aged into adulthood, hearing loss often was present or became more present in their lives. Again, because Cri du Chat is a spectrum disorder, many varying levels of phonatory deficits may be present. Voice and resonance impacts can include a variety of organic voice disorders such as a malformed larynx, laryngeal cleft, paralyzed vocal cords, and the presence of stridor breathing. Most, if not all, of these concerns will need to be addressed by medical treatment, but many people with this syndrome can benefit from behavioral voice treatment throughout their lifetime. As SLPs, we may receive an individual who needs treatment in feeding, swallowing, and voice. However, an individual with Cri du Chat may not need very much treatment from an SLP. It all depends on their individual needs. On this slide, you can find many helpful resources and references. I would like to highlight the 5p- website, specifically the second bullet point, where I list a link to the Caregiver's Guide. I found this information super helpful and would definitely pass along most of it to a parent. Then you can find a few more websites and 5 research articles that go into detail about what the disorder is and different needs and evidence-based research on how to support children and even some adults with Creutzfeldt-Jakob syndrome.